December 1st is World AIDS Day, and this year we should celebrate in the past 25 years that over 20 million deaths from AIDS have been averted globally through developing and delivering better treatments for HIV. That's an incredible accomplishment, going from HIV as a death sentence about 40 years ago to making HIV a chronic condition with which people on treatment can have a normal lifespan. Hi, I'm Dr. Connie Celum, professor at the University of Washington School of Public Health and School of Medicine, where I lead research on HIV biology, treatment, and prevention. I will summarize 5 priority areas where AIDS and HIV researchers are working now. The first is increasing treatment coverage and viral suppression. HIV treatment with antiretroviral drugs is key to the longevity and quality of life of people living with HIV and reduces transmission risk to 0 if viral load is suppressed. Priority research question is how to make treatment even easier for people. University of Washington and South African researchers found that delivering treatment in the community in South Africa led to higher rates of viral suppression than clinic-based HIV treatment delivery. Secondly, increasing the impact of HIV prevention, including through long-acting antiretrovirals for pre-exposure prophylaxis. Despite scaling up HIV testing and treatment, there are still 1.3 million new HIV infections annually, with very high rates persisting among adolescents and young women in East and Southern Africa, men who have sex with men, and sex workers. We need ways for people who are at risk of HIV to protect themselves. University of Washington led one of the studies in Kenya and Uganda, which showed once daily emtricitabine and tenofovir, a single pill a day, has very high efficacy in preventing HIV infection. And these findings contributed to FDA approval of this drug for HIV prevention, or PrEP. While countries have approved this daily PrEP pill, its potential to curb the HIV epidemic has not been fully realized. Recently, a monthly vaginal ring containing dapivirine and injections every 2 months with cabotegravir have shown efficacy in preventing HIV infection. They are in the process of being introduced in some countries. The cabotegravir injection has higher efficacy than daily oral PrEP, but it is costly to make and thus has been slow to move to implementation. We at University of Washington have also been involved in testing a monthly oral pill for HIV prevention. The purpose behind these different PrEP formulations is that the more options people are offered, we will have higher PrEP coverage and impact. A third area is HIV vaccines. Research on HIV vaccines over the past decades has yet to identify an effective one. Recently, 2 parallel, large, well-conducted HIV vaccine trials in the Americas and Africa had flat results. The HIV vaccine field has shifted to testing mRNA vaccines and broadly neutralizing antibodies, building on the success and lessons learned from COVID. 4, HIV cure. Research to find an HIV cure has been challenging, but continues, and is looking at ways to eradicate latently HIV-infected cells, such as through bone marrow transplantation, medications, and gene editing. And 5, HIV policy. Policies and laws are critical to continuing HIV care and prevention access. We need to continue our commitment to the PEPFAR program, which is estimated to have saved 21 million lives through HIV treatment in Africa. Laws in the US that restrict transgender persons from seeking gender-affirming care, and in Africa that criminalize same-sex relationships, represent real threats to accessing HIV treatment prevention. It is critical that we stay vigilant and support programs like PEPFAR that have a global impact and speak out against punitive and stigmatizing laws and policies.